Now we're going to talk about how to work with the IT band, the outside of the leg, to get rid of those trigger points that are between the scapula and the spine, so between the shoulder blades. So what I've done is I have broken them down into 3 sections that match. We have an upper, a middle, and a lower section between the shoulder blades, and then we have an upper and a middle and a lower area on this IT band, and they match. So when we want to get this area to release, we work in the same area that it matches with. Now, to do this work, you're going to be working on the front of the band or the back of the band, not both. And you can review that with the cowboy and cheerleader videos. But the first thing that we're going to do before we start is we're going to actually do a little poke at about a 7 or 8 pressure level here, and a little poke right here. And we're going to ask our person to tell us which one still lingers or burns. So let's say for this person, it's the front that's lingering and burning. So we're going to be working with the side that doesn't hurt. This is where the scar tissue is. Remember, scar tissue doesn't have any feeling. So come up here and actually touch through this area, and you're going to decide in which of these 3 segments they have that heightened area or that trigger point or that tenderness. Let's say it's in this 3rd area right here. So what we're going to do is along this line right here in the 3rd area, we're going to keep one finger here and feel what's going on. I'm not going to press harder and harder and harder. I'm just going to feel. And on this edge with this hand, I'm going to look for the area that feels heightened or thickened, and then makes the change in this hand at the same time. It's kind of a patting your head and rubbing your stomach at the same time kind of a thing, but once you feel it, you'll understand exactly what I'm talking about and you'll get it. So our little area for that 3rd position in both places is right here, and I can feel the change occurring up here between the shoulder blades. Now we're going to go back and check again and look for an area that's heightened, and up here in this first area, there's a little area that needs some work. So we're going to go into this first area and make sure when you work this upper area of the IT band that you go all the way to the hip bone, because sometimes, and that's where the IT band ends, sometimes that little area of restriction can be right on the edge of that bone. So we're going to just put our fingers here, feel for change up here, and work along the edge of that band until we feel the area that creates the change in our fingertips. And that's where we're going to work. All gone. Next place that we're going to check, it's right here in this 2nd area. So we're going to go into that 2nd area all along that line. Remember, you're not in the middle. You're on one side or the other. And you can feel a distinct line to work on. Right there, almost where that 1 and 2 comes together, I can feel that area letting go in his back. Now, this might take you on a little journey where it takes you through a series of sequences 4 or 5 times. Just follow what it tells you. It's a matching game, and we're releasing the responses that occurred in the IT band that created the problem up here in the shoulder blade. That is how you do the release technique for the rhomboids and IT band.